Hi, everybody. Today's episode is how to find a great nursing home. We have with us today Doug Johnson with Hawkeye Care Centers. How you doing, Doug?
I'm doing well, Don. How are you doing today?
I am doing great. So, Doug, if somebody's in need of finding a nursing home for a loved one, or somebody's been hurt and they're in need for a place to go rehab, what should they look for?
Don, that's a great question because many families don't know where to start. It's one of those situations where they've never really thought about placing someone in a nursing home or themselves, and nor have they really wanted to think about doing that. So that's a great question. And however, Don, they can have a positive experience. If they find the right facility that can meet their expectations, in the end, it will be a positive experience for them. But first, they need to do a little bit of preliminary research that's out there. Obviously, you can go to Google, you can do a Google site or Google search, and look at some of the reviews that they have out there within Google. That is an effective tool. The other site that they may want to go to is a Medicare.gov website, which kind of does a comparison of the different facilities in the areas that you're really looking at. It does a cursory review based on paperwork, but once you find those different facilities based on your Google and your Medicare.gov, you probably want to go to those individual websites and really take a look at what are some of the services that they have at their facility, what's the culture that they have at their facility, and it really gives you some good information to ask questions. Because the next step of finding a nursing home, Don, would be actually to call that facility and schedule a tour. And once you go, Don, and do a tour, you're really looking for a few different things in that tour. Number one is appearance. As you drive up to that facility, what does the overall facility look like? What's the landscaping look like? Does it look well taken care of? And then as you walk through the doors, Don, you're really taking a look at, is it clean? As you walk around, does it look clean? How do the residents look? Are they well groomed? Are they clean? Is the facility organized or is it full of clutter? Those are all things that you really take a look at for the appearance piece of it. The other thing when you walk through the door is you're going to kind of obviously use your nose and smell a little bit too. Hopefully it doesn't smell like urine and the air doesn't permeate through urine. Hopefully you have a pleasant smell that and a fresh smell that you have out there. And then also if you can schedule a time where you can go during meals, that would be a real good time to see how staff interact with the residents. What's the presentation and the preparation look like of the food that's served to the residents? And if you get an opportunity, sit down and have a meal with some of the staff that are there. So schedule that time with the person that's giving you a tour and say, hey, I want to have a bite to eat with you. So that would be a good tip. The other thing is the interaction, Don. You're really looking for that interaction that staff have with yourself. How were you greeted when you first walked in? But more importantly, what's the interaction that they have with the residents there? Don, you're really looking for a caring, compassionate type atmosphere when you walk through that facility. Those are the most important pieces of really taking a tour and finding out, is this the right place to go for your loved one or for yourself?
Okay, wow, that's a lot of stuff you got to look for. Well, Doug, tell me, if somebody comes to one of the Hawkeye Care Centers, what kind of experience can they expect to have?
Great question, Don. Hopefully it's a positive experience. They better have a positive experience. But really what we're looking for, Don, is nursing homes as a whole don't always have a positive reputation that they have out there. So as a whole, our job, Don, or our mission, I should say, is to really raise people's expectations, raise the bar of their expectations as they walk through our doors. It's our responsibility to give them a positive, good experience when they walk through our doors, so they feel at home and they feel like this is a great place to come and this is a great place for somebody to live. Don, it's a changing environment out there. There are so many more options available to people than there was 5 or 10 years ago. There's independent living for seniors, there's assisted living, there's home health care, and then there's obviously a lot of new skilled nursing facilities that are out there too. But Don, our focus as a whole is person-centered care. We want to treat that person as a whole, meaning we want to take into and evaluate what was their lifestyle like, what was their past experiences, what were their job and their hobbies, and then how do we incorporate our care to fit their lifestyle and to fit their experiences. So it's very important that we take a look at that, and it gives us a better picture of that person so we can care for that resident better. One of the programs that we have done for our short-term stays are rehab to home program. So it's based on a therapy program that we have at all of our facilities, and it's if you're having a scheduled surgery, or even if you have a surgery that's not scheduled, but plan for your recovery. Where do you want to go to plan for your recovery to get better? And really what you're looking for is a great therapy program with physical, occupational, and speech therapy to have a positive recovery to get you back to 100%. Just to give you a kind of an example, Don, of what we have done in the past is we had a 83-year-old resident that came into us, scheduled a knee replacement surgery, went in the hospital, has successful surgery, came to our facility, planned his recovery with us, and within 2 weeks we'd done physical and occupational therapy and got him back to home. And after he got home, he actually proposed to his girlfriend, and they went on a 2-week cruise after he proposed to his girlfriend. So that's a success stories like that we have, Don, that really help those people rehab as quickly as possible and get back to their home setting.
Oh, wow. I bet a lot of people have never thought about a nursing facility or nursing home for going back for a place for rehab. That's interesting. Well, Doug, so tell me, if somebody's interested in Hawkeye Care Centers, what's next?
That's a great question, Don. What you really need to do is go to our website, which is listed there, which is www.hawkeyecare.com, and go and take a look at all of our different locations. All of our locations have websites. That's exactly where you need to start to really glean what is the culture of our facilities that we have. Is there a facility in the area that would serve your needs? And then once you're there, the phone numbers are there, the contact information is there. Please give our facilities a phone call and then schedule a tour. And actually do it during a lunchtime, like I said, or a mealtime, supper, whatever it is, and tell them that you'd love to have a meal at the facility to try it out. So schedule that time and really look for those things, Don, that I talked about earlier, and really look for that compassion and that caring attitude.
Well, Doug, thank you so much for taking time with us today. This is Don Ferguson with Viper Consulting TV on how to find a great nursing home. Thanks, everybody, for joining, and thank you, Doug, for being with us.
Thank you, Don. Appreciate it.
Okay, have a great day. Okay, Doug.